a speedy recovery. Let's move on. Health Cabinet Secretary Mutahi Kagwe on Wednesday revealed that a high-level team from his ministry had been dispatched to Siaya County on what he termed an urgent mission. This came after Siaya was listed among 21 counties in Kenya where the novel coronavirus has since spread to, having recorded one case. He added that the team, under the leadership of Dr. Patrick Amoth, will also deliver personal protective equipment to medical staff and engage with the county leadership and local residents. So let's now speak to Siaya Governor Cornel Rasanga on the preparations put in place by his administration. Good afternoon, sir. Thank you so much for joining us on News Desk. You're joining us via way of phone. Now, even before we start talking about the preparations that you've put up in place in Siaya County, talk to us about the situation, because as at 14th April, Dr. Massimo Wangangi did say that we have 2 cases in Siaya County. Talk to us about the situation as at now, sir.
The situation is under control, but you remember we had a big problem when the priest, with the arrival of that priest that came from Rome, it gave us some good level of preparedness. And when this other case from Mombasa arrived, again it found when we were prepared, especially with regard to tracing of the contacts. As I speak to you, we have held in the quarantine people that we have managed to trace. When I was leaving the office, we had traced up to around 45, and the safari of tracing them was still continuing. So as far as I'm concerned, up to now there are still 2. The one that the late James Nyango and the daughter, aged 12 years. So I have not heard of any other case. The other cases that showed some symptoms were tried and were tested and found to be negative. And therefore, we are upbeat that we are going to overcome this pandemic. Our level of preparedness is high, and so that is it.
Talk to us more about your level of preparedness in terms of healthcare workers, PPEs, the quarantine facilities, and of course the isolation facilities too.
Yes, we have an isolation. We have set aside an isolation block in Bondo, and we are going to increase the space. The national government did the inspection and found we had originally planned for 10 beds, but we have since increased the capacity to 16 beds in Bondo. And I think we are still going to look for bigger space if need be. Then we also have another isolation space in Siaya with a capacity of over 10 beds. Then the quarantine that we have quarantine places at KMTC, the capacity is 47. We have also since made Urenga in East Ugenya with a capacity of 39. And so far, that is what we have in place.
Okay, lastly, sir, let's get your reaction to President Uhuru Kenyatta's directive yesterday on the national government supporting counties with an additional 5 billion shillings. He actually said that the way counties prepare is vital. So let's get your reaction to that.
Well, that is quite okay. We had already forwarded our budget to the national government. I believe that is just a reaction to the budget that we forwarded there. It could not meet the whole budget, but it could be a good start, so that because earlier on we had not budgeted for this COVID-19. But we have been using our little resources. So if Uhuru Kenyatta has pumped in some money, the better for